Now, this is in relationship to in placing the implants in the molar area. In the molar area, there is what is called as a sinus. That sinus gives resonance to the voice. If a person is having a cold, then the voice is changed. Plus, he's got a heavy feeling. Basically, because the sinus is filled with mucus and it is filled with fluid, so the patient feels, and anybody feels heavy in the head, heavy in the forehead and all around the area. This is because of the sinus. If I am talking right now and the resonance is there to my voice, it is because of the sinus. The sinus typically extends from either the first premolar up to the last molar. So it can be more in some people when there is loss of teeth for a longer period of time, and there can be a bone thickness of just 1 or 2 millimeters. In such cases, it is difficult to place an implant. We want an implant to be at least about 6 to 8 millimeters so that it gets strength. It is like placing any foundation. We want the foundation to be strong. So the procedure to overcome this particular anatomical difficulty is with the help of a sinus lift. The sinus lift is typically a little bit of a careful surgery that needs to be done. It should not be done rashly, but nowadays a lot of people are doing it. Of course, you have to select who is done it, who is going to do it, because it involves a little bit of expertise, wherein flap is reflected in the edentulous area. Let's say this is the edentulous area. You reflect a flap, you make an incision, reflect a flap, expose the underlying bone, and then make a small window in the underlying bone. Tap the window and then get into the sinus floor. The sinus floor is slowly, it is reflected. It is very important to reflect it slowly, because if you perforate the sinus, then you have to again resuture it and it's going to be a bit of an issue. So reflect it slowly, pack it up with graft material, artificial bone graft is typically used, and then place it back and suture it. Implant can be placed in the same sitting also. So you should have a minimum width of about 3 to 4 mm of bone, and the implant can be placed in the same sitting. So this will avoid another surgery.